My name is J.R. White. I am a cardiologist here at King's Daughters Medical Center. One of the biggest things that I focus on with my patients is prevention, because it's always easier to prevent something than to treat it after it has already occurred. One of the things that I do quite a bit is actually smoking cessation. I've helped quite a few of my patients already quit smoking since I've been here for the last 6 months or so here at King's Daughters. We've had quite a bit of success, and of course it's something I want to build on and continue. Everyone should have some focus on prevention, whether it be lifestyle change, diet, or screening. One of the simple things is to follow a Mediterranean diet. That can help prevent cardiovascular disease. Yearly lab work to make sure your lipids and hemoglobin A1C are in control, as well as the average weekly exercise of 150 minutes. And that will help do your part to prevent cardiovascular disease. A lot of people from the area are not very much aware of the Mediterranean diet. And the Mediterranean diet is really the #1 recommended diet for cardiac patients. It kind of has a focus on more complex carbohydrates rather than simple carbohydrates. Like the classic example is your Little Debbie. Of course, that is going to drive your sugar way up and lead to diabetes. Diabetes is a coronary equivalent. Then we start worrying very much about developing coronary artery disease. So in addition to that, replacing maybe 2 meals a week with fish as your main meat source within the meal, as opposed to red meat. Being from Southern West Virginia, we love our red meat. However, it's time to kind of take that step back. We know better now. The easiest one is bread. A whole grain bread is going to be, much better than a bleached white bread. The white bread is going to have a higher glycemic index, and it's going to drive your sugar up, which leads to weight gain, which leads to high glucose, which leads to diabetes. The potato is a delicious vegetable. However, it is not the healthiest vegetable. Anything with color is always very good. Broccoli would probably be the prototypical vegetable to grab instead of potatoes. But and also something that's a little bit more filling. A potato is certainly more filling than a very good vegetable like broccoli. However, you add a little bit of nuts or legumes, for instance, and that is something that's more filling, which is much healthier. My mama was from Gilbert, West Virginia. She cooked with lard, like a lot of Southern people do. And sure, it was delicious, but the fats, the cholesterol that are within that are astronomical. So replace your Crisco, your lard, with an extra virgin olive oil, much healthier, and it'll really make a difference in your diet. Cardiovascular exercise is, of course, the best. Anything that would get your target heart rate based upon your age. The recommendation is 150 minutes per week. So, it's around 20 minutes per day. And I like the way that they limit it to a per week, because, of course, some days we're going to have time, some days we're not. King's Daughters actually offers some low-cost blood profiles. These occur throughout the year. And they include a CBC, a CMP, a lipid panel, a TSH, as well as a hemoglobin A1C. These are offered at various times and are actually relatively inexpensive. Anytime that you are concerned about your heart, at that point, come see a cardiologist. We could always give you a reassurance if we feel like you're in a good spot. So looking at these preventative things is something that every cardiologist should be doing. it's something we certainly do here.